Tune in to NCN on Thursdays at 7 p.m. and the VOG on Fridays at 11 a.m. for the Ministry of Health's weekly program, Health Matters. This program seeks to educate you, the general public, on proper health-seeking behaviors while making you aware of the services available at the hospitals and various health facilities across the 10 administrative regions. You don't want to miss this. Tune in on Thursdays and Fridays. Be educated, be informed, because your health matters. Hello there, and welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you could be on our program on this episode. I've got Dr. Mallika, Mootoo, pediatrician, and Dr. Oneka Scott from the Maternal Child Health Department, and we'll be talking about mostly COVID and adolescents. Ladies, doctors, welcome.
Thank you for having us.
Dr. Scott, I'll start with you first. And, basically what we're seeing on the ground with cases of young ones being infected. And we've got the encouragement of those to get the vaccine. And we have some reluctance in a certain area. What is happening? What's your current observation in Guyana?
Well, Nazim, and I'm grateful that you have us on the program today to address these issues, because all in all, although our uptake of the COVID-19 vaccine among the adolescent age group has been encouraging, there is still a target out there that we have to meet. The Minister of Health, Dr. Anthony, usually addresses this in his morning meeting on Friday with the handover, and this morning he shed some light on the fact that we do need to focus on that age group coming forward. There is some hesitancy in that age group. We're not where we want to get with our target. We've not yet gotten to our 50%. And our target with that age group is not 50%. We're at 95% and over to speak of herd immunity in that community. We know that there have been some challenges. There are a lot of myths out there. And we recognize that some parents are not taking this seriously. They're not taking this matter. Even what we're finding is some parents have gotten their vaccines, but their children within the age group of 12 to 17 have not been vaccinated. And when you do go to them to ask, well, why is it not that your child has not been vaccinated or has not had access to the vaccine, they don't have a positive reason. They don't have one that even needs to have a defense. And so we're really looking at it as civil responsibility. We're looking at it as parents need to take this matter seriously. Children can transmit the virus. Children can get sick. We do have some amount of children in our country between the ages of 1 to 17 that have died. True, most of the 13 deaths that we've had so far have been because of other comorbidities, but children can get sick, and we want to prevent them from getting to the hospital. Our resolve is to vaccinate, and that is the only way we'll be able to protect our children without any hesitation, without any worry, without any fear.
Dr. Mootoo, before we started our program, you were talking about much more needs to be done because there's a push to put face-to-face schooling back on the card. Why are you concerned?
I am actually very happy for our children to go back to school because as a pediatrician, we do developmental assessments on children every year when they come into our clinics. And what we have seen with the younger kids is a lot of speech delay and a lot of delay in social interaction with the younger ones. And we know that this is because they've been isolated to some extent. For the past 2 years, some of them have actually never seen people without masks. And as you know, for speech development, seeing the whole face move is very important. Speech is so much more than just your lips moving. So I am very happy for children to go back to school. However, as Dr. Scott says, we do need to have more children vaccinated or more parents having their children vaccinated so that the children can be safe in school, the teachers can be safe in school. I do know one of the arguments that parents give us every time we ask them about vaccination is that, well, really the children don't really get sick. Or if they get sick, they don't get very sick. What we have seen recently with this new variant that we believe is here in Guyana is that children do get sick. Children do spread the disease, and unfortunately, children do die from COVID as well. But also, if we can protect the children by giving them an extra layer of protection, which is what the vaccine offers, it offers another layer of protection, then we can also protect the vulnerable in our communities, in their homes. There may be children in school or teachers or other staff in schools who for some reason cannot be vaccinated. And therefore, the more children we have who are vaccinated, it creates a safer environment for that school. So I am all for children being vaccinated. As a parent, I do know that a lot of people have fears, but so far the vaccine has proven to be safe and effective for all age groups. So I personally would advocate for our teenagers to be vaccinated.
Well, we've just come to the end of our first segment of our program, and I hope that we will be taking in strides messages by our doctors. Stay with us. We'll be right back after these messages.
Hello everyone, my name is Mallika Mootoo. I'm a pediatrician. I am fully vaccinated against COVID-19, and I am so happy because today I was able to bring my son to be vaccinated against COVID-19. He has just received his first dose of the Pfizer vaccine. I am happy and I am relieved because he will be fully protected by the time he is ready to go back to school. I encourage all parents to get their children vaccinated so that we can safely send our children back to school. Please do not hesitate, parents. Please get your children vaccinated as soon as possible.
Welcome back to our program. Dr. Mootoo alluded to, this notion that children don't get sick. And we know over the years, indeed, mothers must have been doing a good job with breastfeeding and so forth, and children are raised in a good environment. But COVID is something absolutely different, and with new variants and maybe new ones to come, there's a lot of hesitance. There's a lot of ideas by parents and other people as to why, and even some people also are thinking, well, one dose is good enough for me. People make their own judgment and they carry on like a zombie. Your take.
Well, Nazim, in following the science, what I can most certainly say is that, and to reiterate what Dr. Mootoo said earlier, this variant that we suspect that we have in Guyana has taken a toll on our children as well. It is true that our local stats point to the age group of 25 to 35% of age 25 to age 35. That percentage on age group of the population is driving our infections. And then, of course, you have the age group, the 20 to 24 years old, and children and adolescents form a minor part of the global or the national figures. But we cannot deny the fact that we've had children being very sick, and we have to think about those children who have underlying conditions, children with autoimmune diseases, children with chronic illnesses, children who already have an immunocompromised system. And those are the children that we have to protect. Those are the children that we should, as long as they meet the criteria for vaccination, get vaccinated. We're hearing some of the myths that I cannot subscribe to. We're hearing that COVID-19 vaccines will cause early sexual initiation in children, that we're experimenting on our children. And I thought that better sense would have at least by now prevailed, because there are billions of people that have been vaccinated and billions of people who are still with us today and who are well. There are side effects to the vaccines, but they're minor, like any other drug, any other pharmaceutical, any other agent that we use. All vaccines have side effects, and we've been managing those. But in public health, we look at risk and we look at benefit. And in this case, the benefit far outweighs the risk. We want to talk about survivability. We want to talk about our children living and our children returning to normal life. Vaccines are one of the safest ways to ensure that they return to normal life.
We hear that COVID-19, with all its variants, bring up certain symptoms, and yet those people who don't have symptoms, are they still safe even though I don't have symptoms? Is it somewhere, even for children, it will still affect them even though there's no symptoms?
Well, children can be exposed to the virus in their homes, which is a misconception that some people have right now, that they don't want their children to be tested or they don't want their children to be vaccinated because they go nowhere. But if you're living in a home with parents or grandparents who go in and out to work, with the variant that we are seeing here now, or we suspect that we have, it's very transmissible, so they can become infected. Some children may not have the typical symptoms of a cough, cold, and fever. We've seen some children with gastrointestinal symptoms, so some diarrhea and vomiting, as opposed to having the upper respiratory tract symptoms. We've seen children with abdominal pain. So the symptoms seem to be a lot more varied among the younger population, not so much the adolescent population, but the younger ones.
Pregnant mom with COVID takes a vaccine. Is that an automatic vaccine for the fetus, for the unborn child?
Great question, Nazim. So I think this is a relatively new vaccine.
Right.
So we don't have a lot of data as to what really goes on when a mother gets the vaccine. What we do know is that pregnant women seem to be more susceptible to more severe disease. And so we do need to protect them and their unborn child. As with all other vaccines, we know that the pregnant woman can pass on some of the antibodies that she creates through the placenta and later after birth through breast milk. So based on that, we are pretty confident that with this vaccine, it will be similar, and that the antibodies will be passed through the placenta to protect the baby. And later on, when she's able to breastfeed, they will also get them through the breast milk.
And so what have you, because we've heard that there's a number of pregnant women who are, infected by COVID. What would you want to advise mothers to be who might be afraid of, going into that reproduction mode for the fear of COVID? And do you think the COVID environment may have seen a slump in the birth rates of a country or in the world?
Quite on the contrary, Nazim, we've seen an increase in births, but now more than ever, we need to heavily plan our families.
Mm-hmm.
We need to rely on all of the resources out there that will help us family plan. To reiterate what Dr. Mootoo was saying earlier, we have studies coming out of NHS, England, and the UK, and Australia, and Israel that have proven that there are antibodies that have been found in the fetus's blood after the mother's been vaccinated. So we do know that that fetus, that newborn, is benefiting from the protection of the vaccine, although the vaccine is not directly passed, but the antibodies are. The vaccines are relatively safe in the pregnancy. We do know, and we've overused this term, the new normal. We do know that this pandemic has sort of established that, a new norm, but family planning can ensure that you have a safe pregnancy and then later on a safe delivery. Pregnant women are susceptible, just like the general population, to contract COVID-19. So you have to, of course, if you're pregnant, heighten your measures. You make sure you invoke all of the protective measures out there. You stay away from large crowds, large gatherings. You wear your mask. And of course, there are a whole host of other prenatal advice and measures that you must take, including taking your supplements, ensuring that you have regular visits, and you're in contact with your physician and your midwife who will provide further guidance. It should not at all deter anyone from planning their families, but you should do so with the fact in mind that it's not going to be like it was before the pandemic. We do have a new normal.
Dr. Mootoo, you work with adolescents who are, and you specifically want to talk about HIV. What is your feedback and your observation with this particular group that you're working with?
So I actually have to say that our HIV infected patients have really embraced this vaccine. We have had great feedback from them, and we have had great support when we've spoken to them about being vaccinated. Many of them have had questions, and I have to commend the ones that I have interacted with. They have come to us with their questions. They have not just listened to social media or listened to their neighbor or listened to a friend. They've actually come in and asked us, what do we think about it, and listened to us. We've had some very lively debates with them, but I have to say that the uptake in general with our patient population has been excellent.
Your comments on that, Dr. Scott?
To second that, we have had a great demand for our COVID-19 vaccines among the HIV population. They are and did form part of the clinical trials for most of the antigens that we carry, if not all of them. We do know that they are a group that already do have underlying conditions and they need to be protected. Now, with people who have immunosuppression, 1 or 2 shots of the vaccine may not be enough because, of course, the effectiveness of the vaccine may vary. It may be even decreased in people who are immunosuppressed. So those persons have to get boosted to offer that, as Dr. Mootoo referred to earlier, that added layer of protection. Pretty soon, the term fully vaccinated would be synonymous with being fully boosted and being boosted with your dosages that are up to date. We know that in Israel, they are already giving 4 doses of the vaccine, especially to people who are immunocompromised or who have chronic illnesses. So again, we are grateful that some groups are easier to work with and that they have recognized that they did need the additional protection the vaccine offers from COVID-19. Hats off to those persons in that community that have sought out the need to be vaccinated.
Dr. Mootoo, what would you advise, what do you normally advise the young ones, especially now that we are trying to open up schools or daycare? What would you tell parents, and what would you tell the younger kids in school, the one who is in writing exams and so forth? What messages do you want to tell even their parents?
Are these the adolescents
Correct.
or the ones that are younger than 12?
Both, younger than 12s and 12 and so forth.
So for the adolescents, I always encourage all of the parents, once their children are in that age group that can be vaccinated, that they vaccinate their children. But once they're in school, they have to adhere to all of the COVID protocols, because in our fight against COVID, it's not one thing that stands alone. We have to do several things together to make ourselves safe and to keep each other safe. So masks have to be worn in school. Social distancing, as much as possible, has to be done. Hand sanitizing has to be done. They have to avoid large groups. I know that is very difficult sometimes for the kids, but somehow or the other, it can be regulated to smaller groups going outside at different times to play or to interact with each other. Because the large groups are where we see a lot of transmission happening. I know it's very difficult sometimes for the kids because when they want to have lunch or they want to have a drink of water or juice or something like that, they have to take their masks off. So we ask that it's done maybe either when they're alone or with a smaller group of people, and maybe always with that small group of people, so that they're always, should one of them become infected, at least you know who is that group of people that they would have been in close contact with. But I highly recommend that we don't just do one thing. We don't just sanitize and social distance, but we sanitize, we social distance, we wear masks, we get vaccinated, and we avoid large crowds.
Important messages by our doctors and on the panel on our program today. We'll take a break and we'll be right back.
There is a disease out there called COVID-19, so you must remember to wear a face mask. If children wear a mask, we are also helping to stop the disease from spreading to our parents and grandparents, or brothers, sisters, and our friends. We must always wash our hands for 20 seconds using clean water or hand sanitizer before and after wearing the mask. If we touch our mask, we must wash our hands or use an alcohol-based hand sanitizer for at least 20 seconds. Wear a mask that fits your face and covers the mouth, nose, and chin. Do not wear your mask on the forehead or under your chin. Always store your mask in a clean bag after use.
Parents, if your child is 2 years or older, ensure they wear a face mask in public correctly. Remind your child that sharing masks is a no-no. That way, they have fun with their friends and they're safe.
Welcome back to our program. Dr. Mootoo, responsibility, that's a word that sometimes we don't look at seriously. The healthcare professionals have a responsibility, and I'm quite sure those who sit opposite you would like to tell them about their responsibility also.
Thank you, Nazim. So I think I would like to say before we close the program is that we should look at being vaccinated as a public health responsibility. So we may not get COVID, we may not get very sick if we get COVID, but we are taking this vaccine so that we can keep not just ourselves protected, but people around us protected. We keep the vulnerable protected, and the more people that are vaccinated, the less likely we will see variants because there will be less virus circulating in our communities. And that can be something that we do as responsible people. We try to keep others safe. There may be some elderly people, there may be, as Dr. Scott said, some immunosuppressed people who cannot, for some reason at this point, have the vaccines. The little babies can't be vaccinated. But we can prevent them from getting sick, from being vaccinated, as well as taking all our other public health measures in consideration.
Mm-hmm.
Dr. Scott, as we wrap up, I know COVID is swamping everyone, it's overwhelming, but you still have other areas to look at in your department, and one of that is HPV. Tell us what's happening there.
What a glorious opportunity to talk about prevention of disease. One of the things that we always stress upon is that vaccines are part of medicine that helps preventing. There's an old saying that prevention is better than cure.
Yep.
And sometimes in medicine, the cure is not really a cure. And sometimes in medicine, there is no cure. But under our watch, it's very inhumane to have someone die from a vaccine that is preventable, from a disease that is preventable by being vaccinated. The same thing with HPV. We don't want to turn our attention away from the fact that we can prevent cervical cancer, penile cancer, cancer of the perineum, genital warts that are caused by the HPV virus. HPV vaccine is still accessible out there for our adolescents aged 9 to 15 years old, both boys and girls. They can access it at any health facility. Parents, we're encouraging you not to forget that this is another preventative measure that is at your fingertips. Other countries are capitalizing on it. I mean, we often refer to the example of Australia, who's had a very good HPV program. In other countries, they have Gardasil 9 that women up to the age of 45 are still, although they have been sexually active, have children, have an opportunity to prevent cervical cancer by getting vaccinated even in their 40s. So the question we usually get is, how does it work? How does my child get a COVID-19 vaccine and then is still eligible for HPV vaccine? Simple, the spacing, we give it 28 days apart after you're COVID-19 vaccinated, or if the child needs a second or third dose when you get to the health facility, and we work out which regimen we will use. But we don't want you to forget that there is a possibility of ensuring that your child is protected by being vaccinated against HPV.
People should actually be checking up on all vaccines that you're supposed to get yellow fever and all sort of things.
Measles,
Yes.
measles, because we're still fighting measles yonder in Brazil and in Venezuela, and Guyana proudly has not lost one child in over 30. We're 35 years now because we're in 2022 from measles, and that in itself is a remarkable achievement for our nation. Vaccines have been proven to help, and I don't know any other simple way in saying follow the science and let's let logic prevail.
Doctors, thanks a lot for being on our program on this episode of Health Matters. Thanks for your messages. Your messages are very important. Please tune in to, or please, you can visit the Ministry of Health's Facebook page for all the updates as it relates to COVID-19 vaccination sites. Of course, you can see where there are other sites where there's testing to be done. Ensure to stay safe and do join us again next time. Until that time, be well.